Hi, I'm Dr. Fetch with South County Complete Dental Care. Today I want to talk about one of those questions that we commonly get. Anytime you have a tooth taken out, there's usually going to be a big hole there that might bleed. Before you leave the office, our goal is to make sure that bleeding has stopped, either by placing sutures or having you bite on a piece of gauze. As we know, we go home, the numbness wears off, you start eating, you're feeling good, it may start to bleed again. One of the most common questions we get is, how do I get the bleeding to stop? Well, a simple thing that you can do, and most of you probably have it at home, is a little tea bag. Black tea particularly has a lot of tannins in it, which is great for stopping bleeding. If you really want it to get to work, take the tea bag, drop it in a little warm water, just like if you're going to make yourself a cup of tea, leave it in there for just a couple minutes, 2-3 minutes, take it out, let it dry off just a little bit so it's not too hot, and then just fold it up, open and bite on the area where the extraction was done and just leave pressure on it for 10-15 minutes, and that should stop the bleeding. You can use this multiple times, so if the bleeding doesn't stop, you can always switch it out. Most important thing is make sure it's slightly wet before you put it in, because if you put it in dry, it may stop the bleeding, but when you take it out, it may stick to your tissue and cause it to bleed again. Again, this is Dr. Fetch, South County Complete Dental Care, just answering your questions.